So my name's Dan. I'm the CEO of EatWell. We are preventing chronic disease by addressing the social determinants of health for high-risk patients.
So I'm Kevin. I'm the COO of EatWell. Before I came to Boston to do grad school, I had a background in finance, and I was working with oncology and radiology practices at several hospitals in the Midwest, mostly around the Chicago area. And I had the opportunity to start to work on, first of all, some population health programs. And I was a member of the team that started my hospital system's first psychosocial support program for cancer patients. And another component of this was to be how to prevent recurrences of cancer and to develop education for people who were at risk. And the secret is that food and nutrition and basic health underlies the development of at least 60% of cancers and at least 70% of non-communicable diseases. But no one really knows how to roll out programs, even for individual patients that really do want to make a positive change in their lives. And so that was one of the questions that I was asking myself when I came back to Boston to pursue a Master in Public Health degree. How can we really start to prevent disease instead of just treat them with all of the expensive equipment that in my previous career I had been rolling out to patients that also needed it? And so it was very serendipitous that I met Dan, and he had been working already with community members to start to look at how we could deploy meal kits as a real basis of behavior change, to work with groups, with community members to really, develop what they wanted to do with their own lives. And so with that introduction, I'll let Dan go into the founding story for EatWell.
Thanks. Yeah. And so this story, I was starting to give a little spiel on my background, and I realized they're very interlinked because it was quite a journey, and it was not a straight line by any means. I graduated college. I was a bio major. I was pre-med. And then I started medical school at St. George's University in Grenada. I was doing an MD MBA, and I was learning more and more about healthcare, which I didn't really know what that was separate and apart from medicine. And at the same time, I was, doing all these things that you do in medical school, learning the bones of the body and all the nerves and all this stuff. And that's important, but I was like, I don't see how this is going to help people. I don't see how this is going to address the challenges that we're facing when, again, I'm sitting in anatomy, I'm studying nerves, and in the MBA classes that I was taking, we're learning about how we spend more money on healthcare as a nation of both overall and per capita. And 70% of that spending is on services related to preventable conditions. And it really was compelling, and it really said to me, here is a problem, here is a challenge, and I don't feel like this is solving it. I think for a lot of other reasons, from the patient or the societal side, I understood a lot about, here is cost effectiveness, and here is, these conditions are preventable, and what is the way to prevent these conditions? Well, proper nutrition is an underlying factor for all of these conditions that drive costs. These are obesity, diabetes, heart disease, all these types of diet-related conditions, even as Kevin was mentioning, types of cancers. And so I went to do a master in public health, which really gave me a much more patient-centered and kind of environment-centered focus and understanding of the problem. And we started off saying, okay, the nutrition is the underlying, best way to prevent these conditions. So everybody should just eat healthy. Like, boom, what's the challenge there? And it was a very naive perspective. And what I began to learn about and understand were the social determinants of health and food security and all of these factors that make it difficult for folks to have a tasty, easy family dinner. Like, for instance, all food, but especially healthy food, is expensive. And if you live in a community that doesn't have a ton of access to grocery stores, it's even more expensive. It's hard to get to grocery stores. It's hard enough for me to go to the grocery store when I have a car and I live 10 minutes down the block from it. So if you have 2 kids and 2 jobs, and then you've got to get on 2 buses to get to a grocery store and lug these bags back, It's just not going to happen. Um, and finally, cooking is hard. You know, just knowing how to cook and making the time to cook when you have a million other things is difficult. And then, of course, doing it in a way that is healthy and doing it in a way that your kids are going to like it. I mean, I don't have kids, but doing it in a way that I'm going to like it, I'm a bit of a picky eater, it's difficult. And I began to learn more and more about all of these challenges. And part of that was through my classes, but the way that we really started, it was taking a class called Social Entrepreneurship Lab. And the goal of the class was basically come up with an idea that helps people and then go do it. And one of the things that the class really focused on was you need to understand the problem and you don't know anything about it. And for me, I didn't have a lot of perspective on what it's like to grow up and have, you know, challenges with food insecurity or live in a neighborhood that doesn't have great access to healthy food. And I just said, okay, I don't know anything about this, and I'm going to go try and learn as much as I can. And how do I do that? By talking to people. And so I went down to the community where we got our start was in Mattapan. And actually, I'm looking across the wall at this map. I don't think it's going to show up on the screen well, but how I arrived at this was I literally took a screenshot of Google Maps because I couldn't find a map that was an image of Boston. I could find a map that was an image of downtown Boston, but not of all of Boston. There's something else there too. But and so I made this map and I drew in all of the grocery stores and I drew in all of the subway lines and all of the bus routes. And what you see are these big holes in different neighborhoods, in different communities. They tend to be communities that are lower income. They tend to be very diverse communities, and there's no grocery stores there. And you say, well, how are you going to get healthy food? And so I went down there. I went to the Mattapan Farmers Market, and I just kind of started talking to everybody I could. And I started talking to folks at the market. I started talking to people who ran the market. I started talking to different organizations like nonprofits that help to promote healthy eating education and things like that in the community. Spoke with a couple of dietitians and PCPs and health centers and just tried to really understand, you know, what are the challenges? What are the barriers? And those three things of affordability, accessibility, and knowing what to make really came out to be the biggest challenges. And that did, I think, two really important things. Was one, it cemented that the way that anything that EatWell does is going to, you know, come from the community. Because if I said, all right, I have all these ideas and understandings about, you know, food security and all this stuff, and then I'm going to show up and say, here, I made this for you, use it. People are going to look at me like, who the hell are you? And so the other thing that came out of that was I made lots and lots of connections with people, and people knew who I was because they saw me at the farmer's market. They saw me at this meeting. They saw me at this town hall. They saw me here. They saw me there. And people would say, oh, do you know so-and-so? And I was like, oh yeah, I do know that person. And I was in I think a strategy class, reading a case study. And I can't for the life of me tell you what the case study was about, but it had a line in it that really stuck with me. And is, I think, one of the other principles that came out of this kind of founding journey, in a sense, is that change happens at the speed of trust. And especially in underserved communities that have been marginalized and disenfranchised for pretty much as far back as you want to go, me showing up as a white guy from Harvard and saying, you need this, wasn't going to fly. And I just really tried to focus on hearing what people had to say and then listening to them. And because of that, we were able to really, A, create, I think, a solution that really fit people's needs, but B, build trust and build a really strong network that made it very easy for us to grow or to kind of continue to meet people, to learn more and to have more opportunities of trying to figure out how to make our meal kits successful. And so that's kind of, phase one was focusing on the problem, and the customer is always right. And what that means is not just like, okay, yes them to death, but it's like, no, people know what their challenges are, listen to them, and then think about how you can address that or work that. I don't know.